Imagine a future where our healthcare system looks like the one in the US, where you have to pull out a credit card when you go to an A&E before you receive any treatment, where over 500,000 families go bankrupt every single year. That's not a future we want. 75 years ago today, the NHS was born, and 75 years later, we see the service starved of cash and on its knees. And it's in that state because of the actions of politicians. And now the service is getting infiltrated by private companies who are swooping in and taking advantage of this situation while patients are unable to access what they need. US healthcare companies are buying up dozens of GP surgeries. We're in a situation where 7.4 million patients are unable to access treatment because they're on a waiting list. We had a situation this winter where up to 500 people died every single week because they couldn't access the urgent care they need. Things were so crowded that patients were receiving life-saving treatment in cupboards and people were calling for ambulances that didn't arrive. It is an emergency. There should always be money to pay for emergencies. The underfunding of the NHS is a political decision. Why is there not the money to rebuild the NHS that we need to save lives and keep it going for the next 75 years? We need to wake up to what's going on and hold politicians to account. You've got to follow the money in politics. Theresa May, Sajid Javid, John Redwood, Lee Anderson, David Lammy, Wes Streeting, Keir Starmer. What influence is actually being carried by money moving from private hands to the politicians or to the causes that the politicians support? Now, not all these people are receiving money directly from private healthcare companies. Sometimes it's because they do things like work for a private investment firm who has huge investment globally in the private healthcare sector. But all of those things are still linked. And I don't think MPs should be allowed to accept big speaking fees or donations from anyone in the private sector. We know what goes on in the US. We know how much that determines politics and elections. I don't know why we're so blind to it in our country. Money is not given freely for no reason. I don't think there should be any link between private healthcare and politicians. The reason that the NHS was so successful is that it eliminated money from the conversation about who needed healthcare. And that's an enormously powerful thing. When I was working in the service, as a clinician, the knowledge that I was able to deliver whatever it was that the patient needed based purely on their clinical need, and that's the thing that got them to the front of the queue, not their ability to pay. It creates a really fair system. If you're a private company and you come in and you take public money to run a public service, you don't just have the original goals that the NHS services have, you've got an additional priority, and that priority is profit for your shareholders. Now, anyone who says that that motive is not going to interfere with all of the other decision making when you're running a healthcare service is just being silly, because running a business involves things like cost cutting, and that impacts on patients. A study that has come out last summer from the Lancet, and it looks like in areas where there is more outsourcing to private companies, there is an excess mortality. Patient care has suffered, and there is a link between people dying unnecessarily. The knowledge that private outsourcing could be leading to unnecessary deaths should be an absolute alarm bell for the politicians who are running the NHS. Sometimes when I talk about privatisation, people who probably haven't been watching it closely because it's not covered very well by the media talk about me and other people like we're conspiracy theorists, as if we're making it all up. But if you just look at the legislative changes that have happened to the NHS since the 1980s, each one has introduced a new layer of privatisation into the service. The latest iteration of a reform, which was the Health and Care Act 22, broke up the NHS in England into 42 parts called integrated care systems. And a lot of people who are experts looking at what goes on in the US in terms of their healthcare insurance system suspect that the reason that this has happened is to aid a move, the next step, which is to introduce a healthcare insurance model in the UK. I suspect those people are correct. This idea is being seeded out into the public that we need to change the model of healthcare in this country, and it's being done very cleverly because the service has been starved of resource to the point that it's now crippled and people are unable to access what they need. And when people are scared and frustrated they seek answers. And the answers that they're being fed by many of the mainstream media outlets is that perhaps the NHS is simply not fit for purpose, and perhaps we need to look for a different model. And it's very clever because a lot of people are scared and anxious. They don't really understand what the vested interest in all of this is. But the other issue is the underfunding. Since 2010, the Conservative government has underfunded and under-resourced the service to an alarming degree. And we're now in a situation where we have the longest NHS waiting lists on record. They've not been investing properly in the investment into the capital infrastructure of the system. So we've got a situation where the NHS in England has over £10 billion in unmet repairs. And that's causing things like hundreds of sewage leaks into A&Es, maternity units, cancer wards. And they're not fixing these problems. And some of these problems have been judged in reports to be causing a significant risk to patients and staff. And maybe the biggest problem of all is their lack of support for the workforce. You cannot run a world-leading healthcare system if you do not support the staff. NHS consultants, probably the most glaring example of the cuts in pay. They've had a 34.9% cut in their income in real terms since 2008-2009. Consultants are earning more than a lot of the members of staff, right? So if you think about the real terms cuts for porters, or nurses or healthcare assistants, some of those people are now struggling to cope in a cost of living crisis. Many NHS trusts in England now have their own food bank for staff, and that is an appalling situation. If this service is something that we value, and we do, then we should be valuing the staff and treating them properly, because at the moment they're struggling to even put food on the table. I think it's particularly pertinent at the moment that politicians are able to make these decisions that affect the public, and many of them then leave politics and go on to high-paid positions in the private sector. And meanwhile, who's the person who can't get their treatment on the NHS? Well, it's the patient. And the person who's made those decisions has walked off into the sunset, unaffected, unaccountable. And I think that's got to change. I think if you put all of these things together, you can't honestly feel that this government is trying to fix the problems in the NHS. Because if they did want to fix those problems, they wouldn't be funneling money into the private sector to spend millions of pounds on management consultants. They would be spending that public money, paying the staff properly, and getting this service up and running again to save lives. The reality is, we talk a lot about waiting times, as if someone's sitting in a seat like I am now, waiting, but it's just an inconvenience. It's not a problem. It's just I need to be more patient for what I'm going to get. But it's not that way. If you're waiting for treatment in the NHS, you might develop more symptoms. You might become dependent on pain medication you've been prescribed. You might develop mental health problems. You might lose your job. It might break down your personal relationships. You might commit suicide because of the horrible symptoms you've had to sustain for many months or years while you've waited for the treatment which you pay for through your taxes and yet is being denied to you. And that is what's not focused on. And during the winter crises, we think a lot about ambulances. We send news crews to ambulance bays of hospitals. There's a lot of excitement almost talking about the tragic circumstances that lead to isolated cases of patients dying in horrible ways when they can't get the treatment they need. But the reality is that this is a situation now affecting millions of people in non-glamorous ways who are sitting in their houses, whose voices are not heard, and who are being failed by this government. It's life or death in some of these situations. And when we think about the people who are excluded from care and excluded from this public conversation, it's often the most vulnerable people in our society. It's the elderly people or the disabled people or the people with severe and enduring mental health problems, many of whom don't have a support network, many of whom don't have the funds to pay for private healthcare. They need this safety net, and it's a safety net that brings us all up. If we have a healthy population, we have a population with more energy, who can be more productive, and that affects everything. It affects our economy, it affects happiness, it affects the progress we can make as a society. Politicians often boil it down into this budget or that budget, and what we can afford, what we can't afford, and we lose the big picture. We've really got to ask ourselves what kind of a society we want. In 1948, we decided that we wanted this service because we wanted to care for every single person in our society and that everybody deserved a chance. And now, with this government, with this political landscape, it feels like a lot of people don't have a chance anymore. There's a cost of living crisis, there's an energy crisis, the economy's shot, there's so many people struggling, and our healthcare system is in tatters. And there's a sort of complacency or an excuse being made by politicians that because all these things are a problem, therefore there's not enough money to fix any of these problems. It's not good enough. There are so many times in history where humans have recognised that they're in a situation of crisis and they've come together and overcome obstacles to build something fantastic. And that's what the NHS was in the first place. It was built in the aftermath of the Second World War when our country had so many struggles, and yet this fantastic thing was built. And I think right now we have an opportunity for bold, transformative ideas that will mark progress for our society going forward. It's an opportunity, and politicians are not taking that opportunity. It's ludicrous. We need the politicians who are going to come in and look at this and decide that they want to transform this for the better. And the reason for that is that the NHS has transformed millions of lives over the last 75 years, and it has the potential to transform millions of lives for the next 75 years. But it's only going to do it if we push politicians into action. There's a lot of talk at the moment about cost, and I'm sure there'll be people watching this who say, you're not talking about how much this will cost. It will cost a lot of money, but we need to stop talking about cost and start talking about value and prioritising things politically based on what the public wants, not what politicians want, not what their donors want, not what private healthcare companies want, what the public wants, because this is a public service funded by the taxpayer. There are so many problems in the media at the moment, and we really need independent outlets to be able to have a voice. If you can support Double Down News to continue their important work, please do. They're not being funded by private healthcare or private donors. If you can, please support Double Down News. Join Double Down News on Patreon.